Hey guys, what's up? It's your girl Jay. I'm super excited right now because I just did my first interview. What's up? God bless everyone. You're gonna see the raw video of my first nursing interview, guys. So that being said, I'm not editing anything. Don't forget to smash that subscribe button, like, share, and comment down below whatever. I'm all nervous now. What I could have, I can't right now. My nerves are like what I could have improved on. Peace out.
Hello.
Hello, how are you?
Good. My name is Juanita. I'm one of the I'm the care manager right here at Fidelta. I do the training and for trach and vent when new nurses start, and then I also do a lot of interviews here. So
Well, nice to meet you. My name is Jahaira, and I'm also an LPN.
okay, awesome. Heidi and Lydia are probably going to
Hello.
be joining. They're the ones that handle the schedule.
Okay.
Is Lydia gonna jump?
Yes, she will. She's connecting right now.
Okay. Hello.
Hello.
This is Lydia. She also handles like the schedule. How do you say your name?
Jahaira.
Jahaira,
Yeah.
right?
Sí, sí, somos
Ja-
hispanas. If we're Spanish.
Okay, ready to get started. Can you please tell me a little bit about your experience
um, so
as a
I
nurse?
okay. I just graduated my LPN program in March. It got prolonged because of the COVID. So I was supposed to graduate in January. So that being said, we graduated in March. So I haven't started an actual LPN job, but I do have several years of healthcare experience. I've worked in various different settings, starting with home care when I was 18, in nursing homes, hospitals, clinics, and so forth. Currently, I am working for a hospital. It's the CHI, and we work for the Franciscan. It's called the FESC building, which stands for education system. And basically, I'm a cardiac monitor tech, and I monitor several patients, but it can range from 40 to 70 patients all at once, and it's like different critical acuity levels. So it's very fascinating, but that's what I do right now.
Awesome.
During your experience prior to becoming a nurse, did you have any experience working? You said home care. What did you do in home care? Were you a CNA?
Yeah, so I had graduated high school, and when I graduated high school, I had my CNA as well. But before that, they allowed me to get the home health aide certification. It was like I think it was like a 3-day course. So I had that before that, my CNA license, and then I worked as a CNA once I finished high school.
Okay. And then when you were doing that type of work, did you work with just primarily the older patient population, or did you ever work with pediatric?
No, so in that setting, I only did home care, like the geriatrics,
Uh-huh.
but I did work in a clinic for 2 years, and I did pediatrics.
Okay. What did you do in the clinic setting with them?
So I was a medical assistant. So as a medical assistant, I just did triages. I did a lot of the clinical back work, like strep, phlebotomy, strep throat tests, a lot of the lab testing, because I was in New York at the time, so our scope of practice was a little bit different than here
Okay.
in Washington State, but no vaccinations.
Okay. So worked as a medical assistant in a pediatric clinic. Okay, cool.
Perfect. What why you decided to become a nurse?
So I decided to become a nurse because as a child, I grew up in a Hispanic family, and we were part of the underserved community, and I saw a lot of different things as a child growing up that we weren't really treated the same as others. And it could have not only been because we were Hispanic, but maybe insurance or just like poverty and stuff like that. But what really inspired me was because my sister, she was epileptic, and she was really misdiagnosed when she was a child, and it just kind of got out of hand with medication and various doctors that we had to go overseas to El Salvador, and that's when she got diagnosed with that, and then she had to go through a serious surgery, and yeah, it was just really traumatic. So yeah.
Okay, can you tell us about a time where you worked directly, and we'd prefer a specific example if you can come up with one, directly with a client who was really challenging or demanding, and how you resolved that issue? And this doesn't have to be as a nurse, it could be your experience as a CNA or in the, as a medical assistant or whatever.
Yeah, I have a great example. So challenging one was when I was working in a nursing home. I had one patient who he was an ex-veteran, and he really liked particular clothes and those that had like the logo of like military and stuff. And I remember one morning, like our usual routine, we would just get up in the morning, get dressed, and he was a Hoyer lift, so I needed like extra help. But that morning we were really low staffed, so I remember just telling him like, "Hey, let's continue with your routine, but you don't have your clothes that you usually wear." And just saying that, he kind of got out of proportion, and he started to get really mad. So he started to curse at me, and then he actually like smacked me in the face. So yeah, my character kind of changed, and I was like, hey, that's not okay. And at the moment, of course, I was really mad. It could have gone bad, but I was like, no, I understand, like, he's probably not really with it. We were in the Alzheimer's unit, so I understood, and I said, hey, your clothes isn't in there, so do you want to wear something else? And he said no, and he continued. So I just tried to de-escalate the situation, remove myself, and then I grabbed the supervisor at the time, and she spoke to him without me being there and said, that's not okay. And she basically told me it was my call if I wanted to, call the police, and then they would take him, to jail and whatnot. And I said, no, I understand he's not fully there mental wise, and I just tried to understand and give him other options. And then, we just had a serious conversation, all three of us together as a group, and he said, I'm sorry, and then we just moved on. So, yeah.
Wow, good job.
Oh, yeah, that was hard.
Yeah.
I don't know how I would have reacted if someone was me either. I probably would have been like, whoa.
I mean, he said sorry for like 30 days or more, but I was like, okay, Peter, I understand, but
Yeah.
Yeah, that's really good. It is very, like, when you do work with challenging, it just really, you really have to like bring yourself, because our normal way, like Heidi said, like we probably want to like react and probably hit him back. Not just play.
You're crazy, Juanita.
Oh man. I mean, we're only human beings, right? So but no, I definitely understood. I just tried to remember, like, he was really mentally there, but he had his moments, and I think it was because of his ex-veteran situation. He probably had other underlying conditions, but I just try to, be understanding.
Yeah, that was good that you were able to like
Yeah.
take yourself out of it and then like reevaluate the situation and understand that it wasn't like you personally, it wasn't a personal attack. It was the situation not. Or the trigger, whatever that trigger was, right?
Yeah, because he was never like that with me, so.
Yeah.
Lydia, go for it, Lydia. The next question.
Okay, please tell me about a time your replacement did not show and how you handled the situation.
Oh, so I've had several of those situations. So I mean, there's nothing really I can do in that situation, depending the setting that I'm in, right? For example, if I'm in the nursing home that I have worked in, we have to stay because we're mandated by state, and we can't neglect the care of a patient. So I would basically have to stay until my cover would come. Sometimes we would have somebody from the staff room just come, and that could be like the DON, or that could be the supervisor, and just kind of take over for a little bit, which would be very helpful. But in like the winter time, we really didn't have anybody, so we would have to do doubles, and then it would just be a little stressful, but we kind of knew that was happening because it was a mandating facility. In my current situation with Franciscan, we don't really have a mandating situation, but we do have a lot of per diem, so they would quickly, answer the phone and come, not in the first few hours, but probably in the next 4 hours of our shift, so we would have to cover a little bit. Yeah.
Awesome. Can you give me an example of how you were able to positively impact the quality of a client's life?
Yeah. So I had one older lady that we kind of, like, my whole family fell into the care of her because my mom knew a social worker, and the social worker would find cases for her and stuff like that. So my mom started taking care of her, and then I started taking care of her, and then my sister. But when she didn't have any care, she was very like unsociable, and she just had a very diminished care. So when we all just hopped in and helped her with like doing her groceries, cleaning her house, and just doing all these like daily living activities, it kind of helped her a lot. And she already suffered from Alzheimer's, so she was just always like sad sometimes, but she just wanted someone to talk to. So just having us daily there for 24-hour care helped her a lot, and it made a huge impact in her life, that she was always just happy. She was always singing and just doing other things that I didn't see her at first doing. So it just made a huge impact in my life, because I saw that just little bits of this care that we provided for her changed her.
That's awesome. What kind of activities do you like to do with clients?
So it depends, the client, because some clients are limited with, I guess, with mobility, and certain body parts. But I could read, I can color with them, depending what their hobbies are and stuff like that. Walk with them. I think of various things.
Lydia, go for it.
Sorry, I have to keep muting and unmuting. It gets kind of loud in here. So what would your current or most recent or former supervisor say is one of your strengths as a caregiver?
She always tells me this. She tells me that I am quick to acknowledge when I'm wrong, and I'm able to like just advocate for myself and not give reasons for why it happened, but just say, yeah, I understand I was wrong, and I'm gonna try to improve that, whatever it is that she's trying to address, and not put like ands or buts and stuff like that.
That's good. And then on the opposite of that, what would you say, or what would they say is one of your weaknesses?
Probably like training, because I don't really like training people, but people have to train me. And we get a lot of Clover Park students, and we have to train a lot because our unit is expanding, and we just have our own virtual hospital. So we're always getting people. So sometimes it's just overwhelming just having to train people every 3 months, or stuff like that.
Yeah. Okay, so it's more like you training others, not you getting trained yourself.
No. Definitely not.
She's like, I don't want to be trained.
Just training others.
Okay.
Anything that prevents you from doing your job as a nurse? Any limitations?
That's a good question. I don't think there's anything. I know like home care, there's certain things that I really wouldn't like to be in a home if a patient, like if they smoke, because of like I don't really smoke. And not only that, because I do have a child, and he was born like 2-3 weeks early, so just like he has a little bit of like airway issues and like asthma and stuff like that, and just in my family predominantly, so I wouldn't really want to expose him to stuff like that.
Yeah.
So that would probably be like one of my options.
I'm totally there with you. I'm like, I don't like going into a home where people like smoke. And usually you don't. All of our cases, the parents are very like, if they smoke or drink, like they do it outside of like, not within the case. So you wouldn't be like dealing with any of that.
Okay, that sounds great.
Okay. And then what days are you like wanting to like work with us?
So I do have a part-time job right now, and I did speak to, I think his name is John. I told him I wanted to start off per diem, and I wanted to just start off with 1 day a week or bi-weekly to see how it goes and how I feel like, if it's gonna be for me or not. So I was thinking just like Thursday or Friday, but if not, we can do a Tuesday. Tuesday would also work.
Sorry.
Okay, no worries. And do you do like do you prefer long shifts or shorter, 8, 10s, or 12s?
Yeah, so I can do 8-hour shifts would be good. 8 or 10s would be good.
Are you looking for daytime, evening, night?
Yes, daytime.
Daytime, okay. And I'm sorry, Juanita, did you ask already how far are you willing to travel for a shift?
No, go. No.
Okay.
So I can do at least up to like 10 to 15 miles. I don't want to go too far because some places out here are really far.
Yeah. You think like 30-ish minutes, or miles are hard because
Oh, okay.
10 to 15 miles going in one direction could take you
Yeah.
like 10 to 15 minutes, but 10 to 15 miles in another direction could take you 45 to an hour.
Yeah, so I think 15 to 20 minutes. But 20 minutes
Okay.
would be max because 30 is a drive.
Okay. So trying to stay close to home. Okay.
Yes.
Got it. And then Justin went over with kind of what our patient population looks like, pay rates, and all of that. But I like to go over with our nurses that interview from our perspective from the scheduler side. So vast majority of our patient population is pediatrics, complex peds. We do have a few older patients, a couple geriatric clients. One has ALS. We have a paraplegic and a couple of them that have muscular dystrophy. But most of the patients are peds, ranging anywhere from infant all the way up to about 14. I think our oldest one's 14 or 15. Any range of diagnoses and complexities in between with those kids. They could be kids that were born premature. They can have genetic disorders. They could have, effects of a kind of a sentinel event as an infant or a child. Traumatic brain injuries, whatever. Any wide range. A lot of traits, G tubes or GJ tubes. Some of our older patients, or one of our older patients, he does have a Hoyer in the house. Our older patients, they all have Hoyers. Not all of them. Some of them have Hoyers. Sorry. Shift ranges anywhere. The range for the shifts are anywhere from 6-hour shifts to 12-hour shifts, anywhere in between. Most families that have the complex kiddos get approved for 16 hours a day of in-home nursing. And then the families can choose how they divvy that up amongst day, evening, or night. Most families will split it into 2 8-hour shifts, so an 8-hour day shift and an 8-hour night shift, but they do vary just based on whatever their needs are. And then the pay rates, the way those work is they're all based off of insurance contract rates. So whatever the insurance is going to pay us determines what we can pay the nurses. Most of our LPNs right now are making anywhere from 33 to 38 an hour and kind of anywhere in between there. But on average, most of them are falling around 34, 35.
Okay.
I know for sure I don't have any LPNs making less than 33. So,
Okay.
How do you feel about that kind of pay range?
I feel like it's pretty doable. Yeah, it's definitely more than what I've heard like other places make. So
well, we'll get back together as a team and loop back with Justin, and then he'll get in contact with you to discuss any next steps. Okay.
Okay, so nice meeting you guys. Take care.
It was very nice meeting you. Have a good day.
You too.
Bye.